So I'm excited today to be joined by Patrick Jamnik on the Ortho Perspective. Patrick is the president of Episurf USA, and Episurf helps surgeons treat kind of that middle-aged gap patient who doesn't yet quite need a total joint or fusion, but they have arthritis going on. And Patrick and I have known each other for, probably about a year and a half now. We're part of a mastermind together, so we've gotten to know each other pretty well over the past 8 months or so. Patrick's been in orthopedics about 20 years. He has spent significant time with big companies and small, with Zimmer, Stanmore Orthopedics, and Stryker, and now he's the president of Episurf USA. And I wanted to have Patrick on because he has a unique perspective, having worked with both the major players, major market share players in our industry, as well as the smaller companies. So, Patrick, welcome.
Thanks, Stu. Good to be here, and good to see you at a normal time of the day, not our usual
Not our usual
5 a.m. Not yeah,
right.
yeah.
Right. So as I've gotten to know you a little bit over the past year or so and learn more about what you have going on and what Episurf has going on, I tell you, it is pretty cool stuff. And so just to back up a little bit, you take the job of president of Episurf USA and you have no FDA approved products. Kind of walk us through what you were thinking and what attracted you to Episurf.
Sure. I think up front, it's probably really important to mention that while when I took the job, we had no FDA approved products. That is different as of,
Yep.
that is different today. But I had done this sort of leave a large company and go work for a smaller company once before. So I had kind of in my head sort of a cocktail of ingredients that would be really important the next time that I knew that I would eventually go ahead and do this. And I had had a number of conversations throughout a couple of years with our CEO, Paul Reifers, who's based in Stockholm. Episurf is a Swedish-based company. And as I got to know both him and the organization a little bit more, I saw what I consider sort of all of the ingredients for, my colleagues are probably sick of hearing me say this, but I make this house analogy a lot. And in a company like Episurf, I saw a house with a really, really strong foundation. That's really important for a smaller company. You can't take for granted anything that things are sort of in place or are taken care of. But what I mean by the foundation of the house, we were founded by a surgeon, founded by Professor Leif Reed from the prolific Karolinska Institute in Stockholm. And Leif was a lifelong surgeon. He founded the company, and one of the key priorities of the company immediately from really day one was, before we take some of these products out to the market and try to just sell as many as possible to whomever as possible under any circumstance as possible, let's try to get the clinical studies going already. Let's get the quality system in place. Let's get the regulatory work done. Let's get the clinical studies going. That's what I mean when I say the foundation of the house. Right. The foundation of any home, it's sort of it lays under the surface. It involves a lot of sort of painstaking, detail-oriented work. It can be a little bit sort of boring sometimes, but once you have that foundation laid, everything else sort of stacks on top of there, and people like you or me come in and sort of put the fancy roof on and the furniture and the bathroom fixtures and all of those types of things. And it doesn't really matter the quality of all those other things in the house if the foundation is bad. And once you lay the foundation, everything builds off of it, and you don't ever have to go back, or you don't want to have to go back and modify anything. And I saw a company that sort of was to keep the house analogy going, I guess, was sort of in the right neighborhood, and we can talk about the patients and the surgeons that we serve, but was sort of in the right neighborhood, and it had a house with a really good foundation, and it was getting a lot closer to the time to start, putting the walls up and putting the roof on.
Yeah, no, that's a good analogy, and it has to be exciting to be part of something like that. So let's talk about patients specifically, like Episurf products, orthopedic surgeons. What are their patient type that Episurf serves?
Sure. So when we look at how the orthopedic landscape has developed over the past generation or a couple generations, let's say, at the academic center level, surgeons obviously will go and do a number of different kind of fellowships. And let's just sort of stay focused on the knee for a second, and we can talk about the foot and ankle, because our products serve sort of two anatomic regions. But at its core, we serve what we call the gap patient. So these are patients that are roughly, let's say, between about 40 and 60, middle-aged, highly interested in keeping a lot of activity levels, but obviously are in enough pain to be symptomatic enough, to be motivated enough to get themselves into an orthopedic surgeon's office. And what we see through no one's, no fault of anyone, but we see a sort of space, and you can call it the gap patient, you can call it early arthritis. There's a lot of different things to call it, but because in the knee, at least, orthopedic surgeons who are interested in doing knee surgery after their general residency years, they either can go and do a fellowship in sports medicine types of procedures where they're doing, ACL repairs, meniscal repairs, and getting sort of athletes back to peak, sort of physical condition, or they can go do an adult reconstruction fellowship where they're replacing joints in people who are 60, 70, so on. And as a result of that, that's how surgeons kind of have been categorizing themselves. And that's been what they're interested in doing. And these people that are sort of in between, that are sort of,
right,
the oldest sports medicine patients or the youngest arthroplasty patients, they've gotten sort of lost in the shuffle, and they have a bunch of kind of bad options available to them, or less than ideal options available to them. That's how the company started, frankly. That our surgeon founder, who I mentioned, he had a problem at this point in his life with his own knee, and he did some self-diagnosing really quickly and understood, well, oh boy, I'm not, the condition of my knee is not ready for an arthroplasty procedure, but I'm too old for all this kind of injections and physical therapy and bracing and icing and all of these types of things. They're not going to work either. What do I do? So the company started with the knee, and it's sort of a platform technology that has been built that we've been able to then move into the foot and ankle. Now, it's not an arthroplasty type of thing sometimes that in the foot and ankle we're avoiding. It's fusion types of procedures, but nonetheless, these are end stage procedures that work very well clinically, but patients in this age group really don't want them. They feel like they're too young for them. That's sort of, that's grandma's procedure, those types of things. So we seek to sort of help surgeons help those middle-aged patients that have damage to their joints, but are not sort of at that kind of maximally degenerative state where it is time for an end stage procedure.
Right. That's very well said as well. And talking with you previously, I think one of the coolest things that you laid out to me was, let's just take the patellofemoral here, or is, if a doctor gets a patient to have a scan, just walk us through what that looks like, because what you laid out to me is pretty cool with the plan that they get.
Sure. So we don't have any inventory. We're an inventory-less company. So everything that we make is patient matched, patient specific, and it's off of some form of advanced imaging. In the knee, that's MRI based, and the foot and ankle, that's CT based. But for the knee, for the patellofemoral product, for example, so a patient gets an MRI. It's a company specific MRI protocol that we have. It's a mix of 2D and 3D segments. That image, those set of images get uploaded to us, and then we will produce what we call a damage marking report. And those damage marking reports, we will show the surgeon the entire condition of the patient's knee, and we'll map out the surface, the cartilage surface of the entire femur, for example, and patella for the patellofemoral cases. We will map out the entire sort of cartilage. We'll show where the patient has partial damage thickness to their cartilage. We'll show where they have full damage thickness to their cartilage. Importantly, we'll show the underlying bony conditions. So if there's bone marrow lesions or cysts or anything else like that behind the chondral surface, we'll be able to show that to surgeons as well. And then we overlay an implant selection on top of there, comes from a sort of handful of predetermined diameters. And then as a company, we personalize both the implant thickness and then really importantly, the surface geometry. So we are we're replicating, sort of shape matching the patient's, the defect that they have. We're shape matching exactly what it is that we are removing, all of their damaged areas. So the trick that we sort of love telling surgeons after our implants are in, all of our implants are kind of like an inlay. And we tell surgeons, go ahead, close your eyes, run your finger along the surface of the knee, and you really shouldn't be able to tell if you're touching implant or native cartilage, because the surface geometry is replicated exactly. And we of course provide a series of patient specific instruments that come. I like to think of us as a very sort of distributor friendly company in the sense that a dictionary and a surgery center friendly company, but we send a sort of a dictionary sized box of equipment to the hospital ahead of time or the surgery center ahead of time. All of the implants and instruments are sterilized by us. The implant goes in, the instruments get used once and then discarded. There's no dropping off the day before. There's no picking up the day after. We're sort of cutting down 2/3 of the trips for our local distributor partners that they may have to make to a site of care.
Yeah. And then again, the plan that you come out with, it will also say, you'll say, Dr. Smith, this is not a good fit for this patient. There's too much damage, correct?
Of course. I mean,
that is one of the cool things, I think.
We can't hide from from what the images say. And of course, we would love to, for every scan that we receive in, we would love to produce an implant back, but we like to think that we're hopefully building credibility over time, because we will tell a surgeon, like, look at here, you sent it for us. Thanks for thinking of us. However, here's what we saw in the knee. And in some cases, it's strictly contraindicated. In other cases, it's much more of a discussion-based type of thing. But at the very least, surgeons appreciate, thanks for bringing this to my attention. Maybe this isn't the right case. And hopefully we can, and in those situations, we say, we understand. Thanks. We just ask that you send us the next one.
Yeah. And so I think we touched on it, but currently today, the patellofemoral joint is the only thing that's FDA approved, correct?
Yeah, that's right. So we have, we have a patellofemoral joint product that is approved. We have an IDE study going, an investigational device exemption study that's going for a single bone, so femur only, metal only device. Anyone who knows anything about IDE trials know that they're very complicated, very involved, very time consuming. So that is ongoing as well. That's sort of started first and will finish last. And we'll sort of fill in the portfolio as we go with a number of other things along the way.
Yeah. So talking about filling in the portfolio, and I know, with the FDA, this or that, there's nothing, but what are your guys' kind of plans on, near future products, we'll call them?
Yeah, sure. So on the knee, we have the patellofemoral product that's approved. We would like to, I think one day take a look at some sort of tibiofemoral combination. That's more of an instrument project. Anyone who's, surgeons or anyone even from industry that's been in cadaver work, that's sort of the articular cartilage of the medial tibial plateau it's a difficult spot to access. So we've got some instrument work, I think, to try to better understand what we could do there. But our goal ultimately is, to whether it's a 1-bone solution or a 2-bone solution, anything that is in that sort of early arthritis phase of the patient's degenerative curve, we want to be able long-term to be able to help a surgeon out. We'll take the scan in and we'll sort of show, here's what the knee looks like, and here's what we would suggest off of that. On the foot and ankle, we've got a Talus product that has been sold in Europe for a number of years. We don't know the exact regulatory plan for something like that yet. But in the meantime, and I think the next product that we will have to market will be a product for hallux rigidus or arthritis of the big toe. We're getting closer on that, and I think we hope to put in a regulatory submission for that roughly in the summer. These timelines are, they're always a little bit difficult, but that's something we're moving towards very closely. That's not an idea. That's a product that we're, making the sort of final design iterations on at this point.
Right. Well, cool stuff, Patrick. And I know I would suggest to anybody, just go to the Episurf website, and there is some pretty cool technology. Having been in orthopedics for almost 30 years, some of that stuff is pretty cool. And I like the idea, like you said, distributor friendly, sending things in a dictionary size box, or shoe box, it is pretty cool. So Patrick, if anybody would like to connect with you, whether that's a surgeon inquiring about products or even people like me, what's the best way to get a hold of Patrick?
Probably via LinkedIn. I get notices. Send me a direct message on LinkedIn. That's probably the easiest way to do it. You can go to Episurf's website as well. There is an inquiry box there, and certainly if it's a United States inquiry, those will funnel to me very quickly. But I would start with a direct message on LinkedIn, and I'm happy to speak with anybody that's interested to learn more.
Well, great, Patrick. Appreciate the time, and anybody who is interested, reach out to Patrick and see what they have going for yourself. It is pretty cool. So thank you, Patrick, and have a good rest of your day.
Thanks, Stu.